Hey everybody, today we're going to talk about vaginal rejuvenation and what it's all about. What does that term mean and how does it potentially impact our patients in gynecologic surgery? So several years ago, the term vaginal rejuvenation was actually first coined by a group that had trademarked a procedure called laser vaginal rejuvenation, which really was nothing more than an operation that had been done for many years in gynecologic surgery called an anterior repair. The concept behind this operation was to use a laser instead of a scalpel to very meticulously open up the space between the vagina and the bladder to do what's called an anterior repair, or to open up the space between the rectum and the vagina to do a posterior repair. The concept was put out there mainly because the doctors that had coined the term were interested in basically accepting cash as opposed to insurance reimbursements for an operation that was not very well reimbursed by the insurance companies. So that's sort of the background as to how the term rejuvenation came into play in gynecologic surgery. And I think what's important to know is that that particular operation, the concept of tightening the vagina by making an incision along the front or the back vaginal wall, is often done for prolapse. Uterovaginal prolapse is a term used to describe a condition where either one or more of the vaginal walls are bulging into the opening of the vagina itself. Oftentimes, these conditions can lead to a variety of symptoms in patients, either feeling a bulge inside the vagina, possibly having difficulty with urination or defecation. And in this particular case, we want to focus more on the concept of vaginal laxity. The idea of vaginal laxity is that after a woman pushes a baby out through the vagina, that the ligaments and the muscles that are involved in maintaining the birth canal's normal diameter have either stretched or torn to a point that is becoming symptomatic. Surgical correction for this problem has been around for quite some time. However, a lot of physicians that do the procedures were not really operating in the proper anatomical depth to provide the patient with a correction that would truly help with vaginal laxity. What I mean by that is if we just do a superficial incision, not very deep, we can remove some of the vaginal mucosa or the lining of the vagina, but what we really are not doing in that circumstance is getting into the deep pelvic spaces that require more reconstructive surgery. This is why it's very important to see a specialist if you're considering having some sort of operation for vaginal laxity. That can include repairing the perineal muscles, also bringing the levator muscles together at the midline and tightening the entire birth canal as opposed to just the opening. Other methods of approaching this would include some more basic things like biofeedback, or possibly going to a pelvic floor physical therapist to learn how to do targeted Kegel exercises. So for any patient interested in having treatment for vaginal laxity, the most important thing is to first go to see a competent surgeon who has experience in this particular specialty. Some of those doctors may have a focus in urogynecology or minimally invasive gynecologic surgery. Now, after you have that initial consultation with an expert, there will be a series of recommendations made. Those recommendations may vary. It may be that we want to start with physical therapy and exercises. If the problems are very significant, then surgery may be indicated. Recently, there have been a number of products that have been released on into the marketplace as well that are using the same term, rejuvenation, and they're also using the same term, laser. These are products like FemiLift or Mona Lisa Touch. There's also a radio frequency variation called Thermiva. Most of these tools work similarly. The idea would be that the patient has either a mild or moderate problem with laxity, decreased lubrication, urinary urgency, and the concept would be to fire a device inside the vaginal canal that will cause a superficial injury to the tissue, and hopefully in doing that, it can stimulate some collagen growth that can help with sensitivity, possibly help with things like urinary urgency or incontinence, or possibly with sensitivity during intercourse and maybe tightening. I say maybe because the idea that firing a laser or radio frequency inside the vagina, we know that that's not going to repair tissues that have torn or completely avulsed. In that particular situation, we believe that surgery would probably be the more logical solution. The FDA has recently criticized some of the companies that have been marketing these tools, and some of the reason for that is that there are not long-term double-blinded randomized controlled studies that prove that these products may be doing all of the things that the companies claim that they do. However, there is some good preliminary evidence that these devices do actually stimulate collagen regrowth and deposition, and what that can do is improve sensitivity, certainly can help out with moisture, and we're seeing some excellent reports on mild urinary incontinence and on urinary urgency. I would encourage you to please go to our website and review any of the information we have there. And if you've got further questions, you can always reach out to me directly through our website. You can email us or give us a call at the Pearl Women's Center. I hope this is helpful. Have a great day.